Hello everyone, I'm Dr. Pooja and today we are going to discuss a very interesting topic, that is how the caffeine works. So it is the favorite beverage of many including me, and there is a very common question which is asked nowadays, that is whether it is going to be helpful for the weight loss or not. Let's see and let's find out. My question to you as a medicos is, it is going to use one secondary messenger. It's going to act through one secondary messenger, and you have to answer me in the comments which one is that secondary messenger through which the caffeine is going to act. All right. So with that being said, there are many theories, but one major theory, especially if it is acting on the brain, it is known as central effect, which is very common. And what is it? Look in this diagram. With this diagram, it will be very clear to you that how it works. There are many, you can say, effects of the caffeine, but three major effects are: first effect is on the brain, because it kind of delay or prolong your working hours and delay the fatigue, basically, right? How that happens? Remember, the fatigue or the drowsiness that comes because of the adenosine. It comes because of the adenosine, and the caffeine, the coffee contains caffeine basically, and if you have the coffee, what is going to happen? There are adenosine receptor in your brain, specifically in the RAS area, which will give you that drowsy feeling, right? Sleepiness. But as soon as you have the coffee, what happens? It takes around 15 to 20 minutes. So after that, this caffeine is going to go and block those receptors. Why? Because it has the structural similarity to the adenosine, and that's why it is going to go on those receptors and block those receptors, and that's why the drowsiness or the sleepiness is delayed. So this is known as a central effect. So when the adenosine binds to its receptor, what is going to happen? It causes the fatigue, as we discussed, or specifically if we are talking about the brain, it is going to cause that drowsiness effect, right? And caffeine is going to have the structural similarity. It is going to sit on those receptor and delay that drowsiness and prolong your work hours, right? On the other hand, if you go towards the second organ, that is nothing but the adrenal gland. We know on the adrenal, on the kidneys, we do have the cap-like structure, that is nothing but your suprarenal gland or adrenal gland. The medulla part of the adrenal gland releases catecholamine, and the major one is the adrenaline. Now please remember, as soon as you have the caffeine intake, what is going to happen? It is going to go and stimulate the adrenal gland, especially the adrenal medulla, and it is going to release catecholamine, majorly the adrenaline. This adrenaline in turns go towards the fat tissue, that is nothing but your adipocyte, and it will start stimulating more and more metabolism of the fat. It will release the fat so that the fat oxidation will occur. So this adrenaline release will be increased, and that is going to stimulate the fatty acid come metabolism. And which one? Mainly the triglyceride. So yes, it helps in the weight loss, but again, it is going to have its own limit. And one more side benefit or add-on benefit of this is our glycogen is going to get spared. Now, how it is going to act as an add-on benefit? So please remember, whenever you go to the gym, you must have heard that thing that we have black coffee and then go to the gym, so that you'll have a better performance. Why? Because remember, your fat oxidation will be enhanced, and the energy in the beginning that you're getting, that is because of the fat, right? And the glycogen later on, whenever you start having the fatigue, right, or the fat oxidation takes time, meanwhile your glycogen will be used, right? So it actually enhances the performance. So yes, the coffee helps in the weight loss, but remember, if you are backing it up with the exercise, it is going to be even better. Now, so as we know that the caffeine is going to stimulate the lipolysis, helps in the reduction of the fat level. So definitely it is going to be very helpful, and that is one of the reason that it says that it delays the aging also. Why? The reason is in front of you, right? And it spares the muscle glycogen so that the exhaustion, the fatigue is going to be delayed. Third is going to be the muscle contraction. Remember, whenever you go to the gym, it is very important to have that performance level. Now, remember, the calcium release is very important in terms of muscle contraction. The caffeine in turns enhance the release of the calcium from the sarcoplasmic reticulum. How it does that, we exactly don't know the mechanism, but it does what it does, that it releases more and more calcium from the sarcoplasmic reticulum, and hence increasing the cross bridge formation. That means the muscle contraction, the force that you are generating through your muscle is going to be much more, right? And that's why the performance is again increased even in the strength training. So please remember, the caffeine stimulates the calcium release from the sarcoplasmic reticulum, which is going to help us in the building up more and more muscle force. So I hope this chart and this diagram is helpful to you. And the one thing that you have to answer in the comment, that through which secondary messenger it is going to act through. So thank you and take care. Keep studying. Bye bye.